Hi everyone, Dr. Val back for another Sunday mini webinar. Today's a good one talking all about CPAP. If you're intolerant to CPAP and you want to give up, just wait because this video is for you. Who am I? I'm Dr. Val, integrative sleep medicine physician and women's sleep expert. And guess what? I have sleep apnea myself. This is the machine I use. Yep, it's got water in it still. But it was a struggle. And I can tell you the most common reason why people struggle with using the CPAP machine and why I struggled with it is because the mask is super uncomfortable. It's not natural to have something on your face when you're trying to sleep at night, especially blowing all this air in. But I can tell you if you stick with it, watch this video, follow the tips, you can figure it out. So let's get started talking about masks. There are so many different masks out there. I was told, or actually I heard in a podcast, there's over 200. So we can find something that works for you. Got a couple of them here. My absolute favorite mask, and I've used so many out there. I think it really took me about 5 or 6 before I found out the one that worked well for me is this one. It's called the N30. And it's made by ResMed. So this is a non-sponsored video, but it just really works. And so why I like it, it's really lightweight. It's just underneath my nose like this. And that's pretty much it. That's all you need to do. You hook this hose up to the longer hose. And then if you have the auto start, that's it. Then you go to sleep. I can tell you that it's better to especially if you're claustrophobic, and I don't like to have a lot of things on my body in general. Like I barely wear my watch. Start off when you're watching TV, playing on your phone. Just wear the mask. We have patients who are kids who use this, and we can help them use it. So we call it desensitization. When you're on your phone, when you're reading a book, when you're watching a movie, just start with the mask. Get used to having something on your face. So that's number one. Another mask I really like is similar. This one is called the Fisher-Paykel Solo. I like these nasal masks that just go underneath the nose like that, just because they're super comfortable. The more surface area, the more difficult it can be because it just feels like really heavy and stuff. But at the same time, this one's really nice. It goes over your head like this. What I like about this one, it's self-adjusting. So you just tap this and it actually gets more snug. And that's pretty much it. So that's another mask that I like. It's a nasal mask. This is the Fisher-Paykel mask. For those of you who sleep with your mouth open, another option that you can do is use a chin strap and a nasal type mask. But if you don't and you want a full face mask, this one is an option. This is called the F40. It's one of the newer masks by ResMed. Let me see if I can put it on easily. It's a little bit trickier to use because there's more straps. And so for people who are claustrophobic, this is basically what it looks like. And then this strap here, backwards, goes around and snaps there. Yeah. So I'm already feeling uncomfortable with that. That's a full face type mask. And some people do like it because if they sleep with their mouth open or if they have a really dry mouth, then this is an option for you. I don't have any of the masks with the hoses on the head. Sometimes those are helpful for people who move around a lot. The reason for that is these ones, it swivels here and it can swivel around your body if you toss and turn. But the hoses on the head can be helpful because they'll swivel around your head. So that's the thing with the mask. Find one that's comfortable for you. Work with a good medical supply company. Sometimes the medical supply companies will just ship you a mask and you are not stuck with the mask that they give you. So many out there. You can even purchase them on Amazon now. And yeah, there's companies like Aeroflow where you can actually just download something and then you type in, how you sleep and things, and they'll give you a recommended mask. Other companies even have like the software where it takes a picture of your face and it'll fit you for different masks. So yes, don't get stuck with the first mask as the only option. There's so many different types out there, and it's common to try more than one. I would say if you can get your hands on 3 to 5, then you're in good hands. Yeah. So number one reason people have a hard time tolerating is the mask fit. Number 2, I would say probably pressure. And so the thing about the machines now, as opposed to the past, we have a lot of automatic CPAP machines, meaning since we do home sleep apnea testing to diagnose sleep apnea, not everybody goes to the lab. A lot of insurance companies don't pay for it. Then we put you on an auto set machine, which is a range of pressures. And sometimes what happens during the night, if your mask shifts, it can start to leak, and the machine is smart, but it's not that smart. It may drive too much pressure. More leak can drive more pressure, more leak, and then the mask can actually shift off your face. So one thing you can do is let your doctor know, and then they can narrow that range. And that can help because that increased pressure can wake you up at night, but then also the mask leaking, you can hear it or it can be uncomfortable. That can wake you up. A little aside, when I started using my machine, I don't recall this. My husband would tell me I would take off my mask, start snoring, and then put it back on again, which is pretty wild. So I have heard this from many patients unconsciously. They're removing the mask at night. And when I narrow that pressure range, it can help. And also switching up the mask to find something that's comfortable for you. Yeah. So we talked about masks, we talk about pressure. Another thing that I hear often is dry mouth, right? And so the thing about these machines, right? This water chamber here, it's the humidifier. So it's a built-in water chamber. Please use distilled water. Other type of water have the minerals in it and can, just sort of like in your bathroom, that, ring, that white ring, it can build up, but you don't want that going into your lungs. So use distilled water. The thing about these machines, there are different comfort settings to help with that dry mouth. I would say number one, make sure your mask is well fit, because if it's leaking and it drives more pressure, high pressure can cause dry mouth. Number two is you can actually set the temperature to the heating plate. Sometimes it's set as audio. It's set as auto, not audio. At the bottom of this, if you can see this little metal thing, there's a heating plate. And so the temperature is set by numbers. 0 is off, and then it can go as high as 8. 7 or 8 is pretty warm. You can actually start to hear the water bubble. And so, that's a little bit too noisy, I think. But some people, depending on which climate you live, if it's super cold in the winter, you may need that warmer air to just make it more comfortable. So you can set that. And then another thing that you can set is actually the temperature of the hose. And that's something that can be set in Fahrenheit. You may need to talk to your medical supply company to switch it from auto to manual. I think manual is better so that you can make these adjustments a little bit more fine-tuned. But if you don't have a dry mouth, you can keep it on auto. That's completely fine. If you are using a nasal mask, right, a mask that just covers your nose and you have a dry mouth, a couple options. You can get a chin strap, which just looks like a wide ace bandage, keeps your mouth shut. Also, this is when I would say it's probably okay to use a little bit of mouth tape or lip tape just to keep your lips closed. That may or may not work. Even with the chin strap, some people are able to relax their jaw open. So you may need to move up to a full face mask, a mask that covers your nose and your mouth. Yeah. So those are different options there for dryness. Another thing too that I think people struggle with that I hear pretty often is getting tangled in the hose. I sort of alluded to this before. If you want to get a mask that the hose is on the head, so if you toss and turn, it'll swivel around you. Other options include CPAP hose holders. So if you go on Amazon, you can see it looks like an IV pole, something that just sticks underneath your bed with a hole, and the pole holds the hose above your head. It suspends it. That can help. Another thing too is they also just have like really wide command hooks where you can just put the hose sort of at your head or your headboard and just hook it there so it's not going to tangle around your body. It is a 6-foot long hose, so depending where your table is, that can be really bothersome depending on how much you move. Sometimes what I do is just I tuck it underneath the pillow, or I wrap it once around the machine so it's not so long, so it doesn't move too much. Another thing to talk about is sometimes there's too much condensation. So the opposite of dryness, right? The humidifier here, sometimes it's too much humidity. And depending on where you live, I would say I don't hear this often in Hawaii, where a lot of my patients are, more so in California, right? If the humidity is pretty warm on the machine and then the ambient temperature is cool, you might get rain out. And so one thing that you can do is get a CPAP hose holder. It covers it, and it just, it's a 6-foot long hose. So you want to make sure that the temperature is sort of the same all the way through. Another thing that you can do is actually put the machine lower than the head of your bed. Sometimes people have it above. If it's lower, then the condensation, the water particles will go down into the hose. But just turn down the humidification to if you can tolerate it, right? The humidification, just, as you know, it only is used for comfort. You don't need it to open up your airway. Another thing that I've heard from folks, even though they've made adjustments, they have the CPAP blanket, and they still have a lot of humidity, is you may want to get a CPAP mask liner. I don't have an example for one right now, but basically it's a cloth cover that goes around the mask. I had a patient make one herself. She just cut off the top of a sock, wrap it around, and that helped for her. And that just extra cotton or extra fabric can soak up some of that condensation. So that's another option. What else is there? If you have any questions, you can go ahead and put it in the chat. But I would say those are common things. Making sure your mask is comfortable is number one. If you have a dry mouth, adjust your humidifier settings. If you're moving around a lot, have your hose in a position where it's behind you or the hose on the top of your head to make it more comfortable. Another thing that I often hear from patients too is feeling bloated or gassy either at night or in the morning. What that tells me is that you're on a really high pressure, or maybe you've lost weight. 10 to 15 pounds is when I hear it. And your machine isn't auto-adjusting fast enough, or you're set to one fixed pressure. So if you lost weight, you feel gassy or bloated, let your doctor know because they can turn down the pressure. Another thing too is if you do need that high pressure, you haven't lost weight, try different positional changes. So sleep with your torso more upright, get an adjustable bed, sleep on your side. Some patients, we have to do combination therapy, which is using the mask with an oral appliance. An oral appliance is something that the dentist can make. And this one's a custom one. The theory behind this is you move the jaw forward. When the jaw's forward, the tongue's out of the way. When the tongue's out of the way, you don't need as much pressure going in to open up your airway. And so those are different ways that can help. Yeah. So a lot of different reasons why people have a hard time tolerating CPAP. I hope you found this video helpful. If you have any questions or comments, please add it below. And the Sleephoria Sisterhood community is now open. So if you want to learn more about women's sleep health and whole living, please join. The link is below. Until next time, sleep well, everyone.